Welcome to the part 2 of the discussion video. In this video we will be continuing the topic of depression. In any case, if you haven't watched the part 1 of this video, please watch it first, as this is the continuation of that video. Doctor, previously you have mentioned about the causes and signs of depression. My next question to you is, what are the physical signs of depression?
The physical signs include varigouth fold, that is, triangular fold on the nasal side of upper eyelid, and omega-shaped fold on the forehead above the root of the nose. It is known as omega sign.
So, what are the types of depression in general?
The types of depression include major depression. You may hear your doctor call this major depressive disorder. You might have this type if you feel depressed most of the time for most days of the week. The symptoms of which I have mentioned earlier. Your doctor might diagnose you with major depression if you have 5 or more of these symptoms on most days for 2 weeks or longer. At least one of the symptoms must be a depressed mood or a loss of interest in activities. The doctor will prescribe therapy and medications. When therapy and medication aren't working, 2 other options your doctor may suggest are electroconvulsive therapy, ECT, repetitive transcranial magnetic stimulation, RTMS. ECT uses electrical pulses and RTMS uses a special kind of magnet to stimulate certain areas of brain activity. This helps the parts of your brain that control your mood work better. The second type is persistent depressive disorder. If you have depression that lasts for 2 years or longer, it's called persistent depressive disorder. This term is used to describe 2 conditions previously known as dysthymia, low-grade persistent depression, and chronic major depression. The third type is bipolar disorder. Someone with bipolar disorder, which is also sometimes called manic depression, has mood episodes that range from extremes of high energy with an up mood to low depressive periods. When you're in the low phase, you'll have the symptoms of major depression. The fourth type is seasonal affective disorder. Seasonal affective disorder is a period of major depression that most often happens during the winter months, when the days grow short and you get less and less sunlight. It typically goes away in the spring and summer. If you have this, antidepressants can help. So can light therapy. You'll need to sit in front of a special bright light box for about 15-30 minutes each day. The fifth type is psychotic depression. People with psychotic depression have the symptoms of major depression along with psychotic symptoms, such as hallucinations, seeing or hearing things that aren't there, delusions, false beliefs, paranoia, wrongly believing that others are trying to harm you. A combination of antidepressant and antipsychotic drugs can treat psychotic depression. ECT may also be an option. Another type is prepartum, postpartum depression. Women who have major depression in the weeks and months after childbirth may have prepartum depression. Antidepressant drugs can help similarly to treating major depression that is unrelated to childbirth. The seventh type is premenstrual dysphoric disorder. Women with PMDD have depression and other symptoms at the start of their period. Besides feeling depressed, you may also have mood swings, irritability, anxiety, trouble concentrating, fatigue, change in appetite or sleep habits, feelings of being overwhelmed. Antidepressant medication or sometimes oral contraceptives can treat PMDD. The next type is situational depression. This isn't a technical term in psychiatry. But you can have a depressed mood when you're having trouble managing a stressful event in your life, such as a death in your family, a divorce, or losing your job. Your doctor may call this stress response syndrome. Psychotherapy can often help you get through a period of depression that's related to a stressful situation. The last type is atypical depression. This type is different than the persistent sadness of typical depression. It is considered to be a specifier that describes a pattern of depressive symptoms. If you have atypical depression, a positive event can temporarily improve your mood. Other symptoms of atypical depression include increased appetite, sleeping more than usual, feeling of heaviness in your arms and legs, oversensitive to criticism. Antidepressants can help. Your doctor may suggest a type called an SSRI, selective serotonin reuptake inhibitor, as the first-line treatment. She may also Sometimes recommend an older type of antidepressant called NMA, monoamine oxidase inhibitor, which is a class of antidepressants that has been well studied in treating atypical depression.
So doctor, tell us, how can a person prevent depression?
Well, there's no sure way to prevent depression. But you can find ways to handle stress and improve your self-esteem. Take good care of yourself. Get enough sleep, eat well, and exercise regularly. Reach out to family and friends when times get hard. Get regular medical checkups, and see your provider if you don't feel right. Get help if you think you are depressed. If you wait, it could get worse.
So, what is the treatment available for clinical depression?
There are effective treatments for moderate and severe depression. Healthcare providers may offer psychological treatments such as behavioral activation, cognitive behavioral therapy, CBT, and interpersonal psychotherapy, IPT, or antidepressant medications such as selective serotonin reuptake inhibitors, SSRIs, and tricyclic antidepressants, TCAs.
So doctor, can you tell us, what should a healthcare professional keep in mind while prescribing the medication?
Healthcare providers should keep in mind the possible adverse effects associated with antidepressant medication, the ability to deliver either intervention, in terms of expertise, and/or treatment availability, and individual preferences. Different psychological treatment formats for consideration include individual and/or group face-to-face psychological treatments delivered by professionals and supervised lay therapists. Psychosocial treatments are also effective for mild depression. Antidepressants can be an effective form of treatment for moderate-severe depression but are not the first line of treatment for cases of mild depression. They should not be used for treating depression in children and are not the first line of treatment in adolescents, among whom they should be used with extra caution.
Doctor, you mentioned about the side effects of the medication. What are the possible side effects of depression medication?
Well, the side effects could be gastrointestinal side effects like nausea, which is the most common side effect, then constipation, anorexia. There could be sexual dysfunction like decreased libido, poor erection, delayed ejaculation. There could be QT interval prolongation in the ECG of the heart. There can be central nervous system symptoms like vivid dream, insomnia, sedation, seizures, emotional blunting, extrapyramidal side effects. There can be inhibition of platelet aggregation, which is important from blood clotting. There could be weight gain and hyponatremia, that is, decrease in the body sodium levels.
So doctor, how can we deal with these side effects?
Well, some general things can help you ease side effects when taking your antidepressants. Eat small, more frequent meals throughout the day to help your digestion. Drink plenty of water. Cut back on sweets and saturated fats. Eat plenty of veggies and fruits. Keep a food diary so you can see if something you're eating is ramping up your side effects. Practice relaxation methods, like deep breathing or yoga. Get regular exercise. Depending on which side effects you have, there are specific things that can help. For nausea, suck on sugarless candy, and ask about a slow-release version of your antidepressant. Take the medication at night so the nausea doesn't bother you as much. For sexual issues, have sex right before you take your antidepressant, when effects are lowest. Talk to your doctor about other things that can help, like estrogen cream or erectile dysfunction medication. Fatigue, take your meds at night before bed. Try to have a short nap during the day, too. Trouble sleeping, take your antidepressant in the morning instead of close to bedtime. Stay away from caffeine, and ask your doctor about any medicines that can help you sleep. For dry mouth, carry water with you throughout the day, suck on nice chips, or chew gum. Try to breathe through your nose instead of your mouth. Talk to your doctor about medication that can help you make more saliva. For blurred vision, Ask your doctor about special eye drops that can moisten your eyes. For constipation, eat plenty of high-fiber foods, or take a fiber supplement. Stool softeners can help, too. For dizziness, move slowly, especially when standing up. Take your antidepressant at bedtime.
That brings us to the end of this segment. Doctor, thank you so much for joining us here.
Thank you so much.